Hi everybody, it's Dr. Tucker here, and want to introduce a new member of our team, Dr. Packer.
Hi. I just wanted to say hello and just introduce myself a little bit. So like Dr. said, I'm Dr. Packer. I'm a recent grad from Palmer, Florida. Just moved back from Port Orange and back home to Langhorne, where I grew up. Over my time at Palmer, just kind of really fell in love with chiropractic as a whole, but as well specifically for pregnancy and for pediatrics.
All right, so I think today maybe we'll focus a little bit on pregnancy-based care and some things to consider for someone you know who might be pregnant. So when you're pregnant, I think a big management concern is you can't do some of the things you normally do for those common symptoms. So if you're having back pain, sciatica, hip issues, knee problems, ankle pain, a lot of times when the body's going through such structural change, you're releasing certain hormones that are loosening up the ligaments, you're getting this extra laxity and instability, and ultimately now you've got extra weight, various alignment changes, and it's creating a lot of irritation to the body. So for those people who manage their symptoms usually chemically, medications and pills of sorts, or even injections, these aren't options they ideally would do when they're pregnant. So chiropractic tends to be a very safe alternative because it helps manage pain naturally and stabilize the joint. So I think the first big consideration for anybody who's pregnant is to try to manage their symptoms naturally, and I think that's where chiropractic does great. So
the actual technique we use is called Webster's technique. This is specifically for pregnancy. Basically, the gist is we're trying to balance the pelvis by utilizing techniques to release tight ligaments, use a little soft tissue for some of the muscles that support the sacrum, as well as adjusting the pelvis as well. We do this sometimes through a drop technique or maybe even some manual adjusting, but all in all, this is definitely a safe alternative for mom and baby as well.
And a couple considerations there is this. A woman might ask, hey, I'm 8 months pregnant, how am I going to lay on a table? So the tables adapt. They're designed for pregnancy cases to adapt to the abdomen. So there are specific dropout mechanisms for this. Plus, not only just can an anticipating mom expect some traditional techniques to help her joints move better with chiropractic, but as Dr. Packer mentioned, Webster's technique is another safe alternative management style, not just for mom, but for breech babies as well. So if somebody gets an ultrasound, there's 2 weeks to go, and they find out that, hey, we don't have that vertex position we want, there's an alternative here, and again, it's a very safe and light technique. Now, any other incidental benefits you think for pregnant patients?
Definitely, I would say that one of the biggest findings from people who have been under chiropractic care during pregnancy would be reduced labor times. I think that's one of the biggest things women struggle with when it's either their first or a second. They're wondering, how can I go through pregnancy or labor comfortably? And chiropractic care, because we set this ball rolling for perfect positioning with the pelvis, we're decreasing the resistance that baby has to go through during that active labor time, and just increasing that pelvic canal that baby can come through nice and quickly.
Absolutely. So if you have a certain diameter, a certain space that you need for optimal delivery, and now there's some sort of pelvic torquing, misalignment, that canal is going to actually narrow. So if we can optimize alignment to increase the space of passage, that's going to obviously simplify the procedure a little bit more than beforehand. So anything we could do, again, naturally to increase alignment, mechanics, help for this process, and the biggest takeaway is it's natural. So you can help this with chiropractic without any sort of strong side effect considerations. So thanks for your time, and if you have any questions, just leave us a comment below.
Thanks.